Early flu vaccine effectiveness numbers have been published by the CDC in their latest morbidity and mortality weekly report, and we're going to go over what this means. Keep in mind that when I say vaccine effectiveness, it does not mean that if it's 80% effective, that 20% of people, it won't work for them. What it means is that for those who are vaccinated, 80% less people will contract the disease compared to those who are not vaccinated. That being said, for children and adolescents, when they looked at 4 different vaccine effectiveness data sets that was collecting data from October 2024 to February 2025, for children, it was 32 to 60% effective at requiring an outpatient doctor's visit because of influenza, and it was 63 to 78% effective at preventing hospitalization due to influenza. For adults, the effectiveness against outpatient visits was 36 to 54% effective, and for hospitalizations, it was 41 to 55% effective. Keep in mind that vaccine effectiveness does increase if you have higher vaccination coverage. So unfortunately, the uptake of flu vaccines are relatively low. Depending on the age and the data set used, it was anywhere between 22 to 40% of the population was vaccinated. And we know that if more people are vaccinated, then less people are likely to come into contact with that virus. As an example, there was a study published in Clinical Infectious Disease that estimated that even if you increase vaccination coverage by 5%, you could potentially reduce the number of illnesses by 785,000 people and reduce hospitalizations by 11,000. So while this vaccine data is showing that it is not highly effective at reducing the risk of getting an infection, it is highly effective at reducing the chances of hospitalization, truly taking influenza from being wild to mild.